Can we? Do I have permission to? Okay. Let's look at the fourth module on assessment. We discussed intake. We discussed screening. Along with screening, we discussed brief intervention. Now we go on to assessment. Tell me, based on screening, for whom do you do assessment? Whom do you do assessment? Give me an answer. I can't, I don't know. I won't be able to access the chat room. Tell me people. You did screening. Whom do you send for assessment? People with at low risk of substance use problems, moderate risk of substance use problems, or severe risk of substance use problems. Whom do you do assessment for? Oh, yes. Severe or high risk. Yes. So you do assessment. You do those with high risk. When you do assessment, you are no longer trying to separate, like suppose you continue with Park's story, you're not going to do assessment separately for opioid and separately for cannabis. When it comes to assessment, we are looking at the client as a whole. We want to understand all the problems in his life. Your screening told me Park is at high risk substance use related problems. He is having some cannabis use, but a lot of problems with heroin use. Even if one area is at high risk, you send him for assessment. Park was at high risk for heroin use and moderate risk for cannabis, isn't it? Yes or no? Yes. So now, when you do assessment, you assess everything together. Now, no longer we separate everything. Okay. So in this module, we'll see what to do to assessment. We're going to talk about domains of assessment. Okay. When you're asking about assessment, we want to remember that the counselor's role is as a guide. Look at the picture there on the PowerPoint. The client seems lost. He's thinking. He doesn't know which way to go. He follows the left, right, follows the red arrow, green arrow, blue arrow, yellow arrow. Everything is very, very confusing. But he's hopeful. Right in front of him, he sees a lot of stars. He's hopeful. He's hoping that his life will become very beautiful and very meaningful. Every client comes with some kind of a hope like that, but he is lost. Your job as a counselor is to ask what his goals are. Try to understand what kind of support he needs. Respectfully offer him guidance and information so that he will be able to make that journey. When he is making this journey towards growth, the counselor works in partnership with the client. Counselor working alongside with the client. One of the famous lines that I like about counseling is that one of my early teachers taught me this. He said, don't walk before the client because the client may not follow. Don't walk behind the client because the client does not know how to lead. Walk beside the client and look for options. Search for directions together. Walk with him. Help him think about the next few steps. Offer him encouragement. Be his support. Then the client is likely to make the journey in a very comfortable way. Am I making sense?
Yes.
Okay. Thank you. Now let's move. What is assessment? I have highlighted in red the most important points. It's in depth, meaning it is in detail. You collect lot of data and information. Some information you collect from the client. Some information you may collect from his previous medical history. You may do a urine test. You may get some information from his family. You may get some information from his employer. The police may send some information. So you getting information from many sources. Why are we getting this information? So we understand what the client needs. What does he want from the treatment program? Once we know what he needs, we know where to take, how to walk the the next point I want to impress is it's an ongoing process. When the client gets admitted to your treatment center, you do a detailed assessment. After that, at least once in 3 months, you should do a proper assessment because client's needs keep changing to understand where he is going. In the assessment, we are not only trying to understand the client, we are also beautifully trying to build the relationship with the client. In the session day before yesterday, I presented that picture. I said the client is here, the counselor is here. The magic that happens between them is because of the relationship we build with the client. During assessment, that is the start of building a good relationship with the client. During assessment, you listen to me. You are respectful towards me. You are appreciative of me. That means when you start treatment, I will trust you more. I will respect you more. I'll be more motivated to participate in the treatment with you. So even though assessment is about gathering information, it is also a point of time where you begin that beautiful relationship with the client. Do you get me? Do you understand what I'm saying? Thank you, Dr. Arkar. Okay, I want to tell you a small story now. There was once somebody got 6 blind men who cannot see. For the first time, they were taken to a the elephant was a very tame elephant. It doesn't hurt anybody. So they were allowed to touch the elephant because they are blind. They cannot see. They said, touch and feel and see. Tell us what you see here. So all the 6 men touched the elephant. Okay. So one man touched the elephant. He touched the elephant's legs. And he said, this is like a pillar in our hospital. It's a big pillar. It's very strong and very long. Little rough, but it is a pillar. Or maybe it is a tree trunk also. I'm not sure. That's what the first blind man said. Then the second blind man touched the sides of the elephant and he said, blind man said, he touched the tusk of the elephant and he said, this is like a spear. The edge is sharp. I know this is a spear. I am very sure of it. Then the fifth blind man touched the trunk and he said, this is like a rope, a very thick rope. Then the last guy said he climbed over the elephant and touched the ears. He said, this is like a nice fan. It's thin and it is moving. I think it's a very nice, soft fan. Were any of the blind men wrong? Were they right? They were not wrong. They were not wrong. But were they right? Were they were correct? Could they see the elephant? Thai people, you have my permission to unmute. Make some noise, protest.
They didn't see elephant in a hole.
They didn't see the elephant. Very true. They didn't see the elephant as a whole.
Oh.
They looked at one part and decided what it is. Often in an addiction treatment center, this is how counselors, doctors, nurses make an assessment of a client. I look at the history and say, oh, heroin user, injecting drug use, 3 times in treatment. I immediately, my head says, high addiction potential, previous failed treatments, chances of recovery very poor. I missed many other aspects of the client. I did not recognize that in spite of his heroin use, he managed to retain his job because he's very good at his job. In spite of his substance use, I know he's very fond of his mother. He knew that his wife has become pregnant and is now ready for the sake of his child to give up heroin use, whatever it takes. He wants to quit once and for all because he wants to be there for his child. I miss out on all this and I failed to recognize the strengths the client brought with me into the treatment center. So I am like a blind person. As a counselor, I am an ignorant counselor. I'm a very poor counselor. I didn't recognize the whole human being behind the problem. I looked at his substance use and nothing else. So when you train counselors or doctors or nurses, help them see the person as a whole. Help them assess him as a person. Anybody else wants to make a comment? Yes, Dr. Ong. There is no right or wrong. It's your perspective. And as addiction professionals, our perspective need to be come from the right place. Yes? Yes?
Yes.
Okay. Any comments anybody wants to make? Any comments? No comments? Oh, you can use the chat box if you want to. Guys, if you do not have any comments to make, give me a thumbs up sign so that I will proceed. Otherwise, I think. Okay. Thank you, Dr. Akar. Now, before this, I want to do something. I want to ask you, when you assess people, give me a minute. I'm doing something else. Just give me a minute. What I do? Go here. Go here. Okay. Tell me. Let's do the large group activity. If you want to assess a client, what all kinds of information do you want to know about the client so that you understand him fully? Please unmute your mics, Thailand people. I request the Myanmaris to either type it in the chat or you will call out and tell me. I want this to be a participatory activity. Tell me, what all pieces of information are very important that you need to know from the client? Personal data like what, sir? Personal data such as name, age, occupation, all this you know in the intake. All this you know in the intake. Go further than that. Now we've come to assessment. You know all the basic personal data. Tell me what, in terms of assessment, what do you know about the client? What would you want to know about the client?
The type of substance abused.
A type of substances that he's using. Okay. I'm going to type it in as you tell. Okay. Type of substance used. Okay. Type of drug that he's using. What else?
Is it single or multiple drugs abuse?
Okay. Is he using one drug or is it multiple? Okay. Whether he's using one or he's using more than one. If so, you want to know the name of the drug. What else? Is he living alone with who? That means you are trying to see the family environment or living in, let's say, we're talking about the living environment, because if he's living with somebody, you will see that as being very positive, isn't it? He has a family who cares for him and he lives with him. Okay, what else?
Resource capital
I can't hear you, sir.
to assess his resource.
Very good. So you want to know about the resources of the client. Okay, what kind of resources you want to know about him, sir? Go ahead. Good, good, good. We're making good progress. Go ahead.
Recovery resources.
Like what, sir?
His family supportiveness, family support. And
Okay,
a
whether
good
the
financial-
whether the family is supportive towards him, whether they're willing to participate in treatment, visit him, provide him encouragement, etc. What else?
financially, whether he is financially stable.
Okay, you want to know whether there is financial stability. Stability may be there, then you see it as a resource. What else?
So about education.
Pardon, sir?
Education status of the clients.
Education status. In what way does it become a resource, sir? You are right. I agree with you. In what way does it become a resource? You are right. You are correct. But tell me why? In what way? Education is a resource, but what else? Why? Why is it a resource?
Because and I will know how can I explain him about.
Okay. So you know that his ability to read, understand information may be much better. You know what you can understand material. If you give him homework, he'll be able to do, etc. So his education is important. What else? Are the Thai participants angry with me? Are they punishing me? Thai participants, you muted yourself also. Please unmute. Add at least in the chat something you tell me. Thai participants. Tell me, what all information do you want to know about the client during assessment? I can't hear you. I think you are muted. Now you unmuted. Tell me, madam. You want to know whether he's employed? Okay, good. Employment may be a resource that he has. Okay, what else? What else?
Community resources.
Madam Supapak is saying you want to ask them what they need. Okay. What they need is something that we get as a result of assessment. Like the blind man, we understand how the client is in every area. Based on our complete understanding only, we identify needs. Identifying needs is the next step. The first step. Know the client, understand the client. The exercise we are doing now is to know.
You see the health history.
You want to know the health history, like what, madam? Like what? You are right, but tell me.
Like whether they have any chronic illness, for example.
You want to know whether there are any chronic illness, okay? Because we know that drug use can bring with it lot of negative consequences, isn't it? So we want to talk about, we want to know about the negative consequences, because drug use might have caused the health problem or made the health problem worse. So you want to talk about his health. Okay, what else? What else? What else do you want to know about the client? You want to know? Oh, sorry. I have not been listening. I have not been looking at the chat. Wait. Some people have written something about about this. Let's see. We want to know community resources. Sir, when we are doing assessment of the client, we are focusing fully on the client. We want to know about him. So that time, this okay. HIV and co-occurring diseases. Okay. So you have health, you have co-occurring disorders. Go ahead.
Occupational problem, legal problem.
I didn't hear you, sir. Louder, sir. Your mic is not clear. Louder, sir. Talk louder.
Legal problem.
Huh?
Any legal issue in client. Legal
Pardon?
issue.
Legal issues. Okay. Yeah. You want to know whether the legal issues of the client. Go ahead, sir. Yes. Thai people, tell me. Jay, you're just looking at me. Tell me something. Tell me something else. You want to know whether he's married, because if he's married, it's possible that he has a wife who may be supportive. So you want to know that. Go ahead.
Relationship in family.
Pardon?
Family relationship.
You want to know about the family relationships. If the family relationship, if it is a family relationship is good, it becomes a resource. Or because, oh yeah, withdrawal, yes. Let me put family relationships in first, please. Then you want to know about the withdrawal that may happen. Okay, go ahead. Go ahead. What are the things? Pardon?
Separate.
Yes.
Separate.
Pardon?
Separate.
The mic is not clear. The microphone is not clear, madam.
On the marital status.
Marital status. Yeah, we put marital status here. We said married here. Okay. Married is here. Yes. I can see Dr. Arkar has taken Dr. Shiva's clear instructions very clearly. You want to know about any kind of sexual abuse, okay? Sexual abuse may not be related to substance use alone. It could be one of the negative things that happened prior to substance use also. Okay, go ahead. Okay. Is there anything else Thailand wants to tell me? Any previous treatments? Very good idea, Dr. Arkar. Yes, Natisha, you want to know about suicide, you want to know about previous treatment. Very good. So you talk about previous treatments, okay? You want to talk about suicide, then anything else, Thailand people? Anything else you want to add to the list? I'm waiting. I'm waiting. If you don't have anything more to add, you have to tell me thumbs down. Then I will stop waiting for you. If you're discussing and you want to answer, I will wait.
มีอะไรไหมมีไหม
ไปในเชื่อมาแล้วไม่มีแล้วเราจะได้ไม่รอเขาบอกถ้าไม่มีแล้วไม่รู้เขาจะโดนขอมีอีกไหมคะ
มีไหมคะ มีไหม มีแล้วเนาะ
status
mental status
Legal status, yes, we have written it here under negative consequences. Can you see? Can you see it on the slide?
mental นี่หมายถึง mental
he said mental
Mental.
status
Mental status. So in co-occurring mental and physical illnesses, you have covered it.
อ๋อ
Yeah.
โอเค
What else?
Okay.
So you finished? No more?
Finish.
No,
Yeah.
okay. Okay. See, when we focus only on substance related problems, we are talking about substance use, how is he using it, what are the withdrawals, what are the problems he has faced because of drug use, etc. Previous treatment, suicide risk. Very good. Excellent list. I am very happy that as practitioners, you not only looked at problems, you also looked at resources the client has. Many counselors miss that. We've all trained to look at pathology, at problems. We don't look at the positive side of the picture. I'm happy that all of you looked at the positive side of the picture. You try to look at his strengths. Does he have family support? If he's having a job that is positive, you said if family support is there, it is good, very good. But we are only halfway through. There are two other dimensions of assessment. One of the other dimensions is the client's motivation or the client's readiness to change. Remember the stages of change? Because we know motivation stage, we have to do a different kind of intervention. Let's take a quick quiz and see whether you all remember. I'm going to say something. You have to identify which stage of change I am in and then tell me what you have to do. Okay? Let me type the question here. Okay? I am saying I'm taking drugs daily. I'm injecting heroin, but there is no problem. Which stage am I in?
Contemplation.
Pre-contemplation. Very good. Excellent. Suppose I am saying, of course, it's causing problems, but you see, I heard that quitting heroin is very difficult. Withdrawal is very painful. I'm not sure. Which stage am I in?
Contemplation.
Very good. If I say that I'm fed up actually with my heroin use, I almost died because of overdose. And I thought, what will happen to my mother if I die? I don't want her to go. I don't want her to have the pain of losing a child. I have decided to do something about my heroin. Which stage I am in? Preparation. I'm saying, okay, you are going on telling me to get admitted in your center for 6 months. I'm ready to get admitted. Which stage I am in? Action. Very good. So you find out the readiness of the client. This will give us a very important piece of information which will tell us what's next steps we have to take as counselors. The next important dimension is called as function analysis. I want to understand the role that substance use plays in his life. This will tell me how I can break that connection. Every substance user who came for treatment has a special relationship with drug use. There are some things that he likes about drug use. There are some things that he enjoys with drug use. Unless I understand the special relationship, I won't be able to break it. So functional analysis is the other dimension of assessment. Is this clear so far?
Yes.
Thai participants, can I have a thumbs up or a thumbs down sign? Thank you, Dr. Arkan. Myanmaris have given me a go ahead. What about the Thais? Thank you, thank you, thank you, thank you, madam. Thank you, sir. Now let's go. I want to go back and look at that when I do assessment, I must be very sensitive to the gender, to the culture, to the disabilities, etc. If the client cannot hear, obviously I need somebody with sign language or to do the assessment. The client talks in a dialect which you do not know, then you have to get a translator. After collecting the details, you develop the treatment recommendation. Train all your staff well. Provide them supervision. Check if they do good assessment. Because if the assessment is good, and will be fine. In one of the crises in one of the treatment centers, the intake counselor was busy. So another counselor took the history that day. The client had attempted suicide 1 week ago. She did not flag it with the doctor. 3 days after admission, the client attempted suicide in the treatment center. If that junior person had been trained well and somebody had scrupulously supervised every session or reviewed the records, that attempted suicide could have been avoided. Often we miss big things because we have not trained our staff well and did not provide them adequate supervision. So check your treatment center's procedures to see if everybody has been trained and they are adequately supervised. Remember, any good assessment is good only when it is documented well. If you don't write it, then there is no point in spending that 1.5 hours in good treatment. Okay. So let's look at the 4 dimensions. Okay. I'm just moving forward. There are 4 dimensions in assessment. First one is to understand. This slide is there present over many slides in your book. I am not adding any new information. But to make it easy, I put all the domains in one slide so that it is easy for explaining and for you to understand. You don't have to make any notes. All of it is there in your books. Okay? 4 domains are there. First domain is about the nature of SUD problems. You want to know quantity, frequency, what are all the negative consequences. We want to know about the substance dependence, meaning we want to be able to get data related to the DSM-5 criteria. Yes? How many criteria were there in DSM-5, please, for substance use disorders? Make a guess. How many criteria were there? Thais, unmute yourself. Use your chat box. Tell me. How many criteria in DSM-5? Hello.
10. I think I don't remember exactly.
11. So how will you be able to assess the intensity of substance use disorder? Only when you collect information and you get if you get 3 or 4, then you know it's moderate level. You know it's 6 or more, it is severe level. So you gather information to understand the severity of the disorder. Domain 2 is about assessing motivation for change, which we discussed recently. Domain 3 is to identify the strengths and resources of the client. Number 4 is functional analysis. Okay, let me, you are familiar with domain 1, 2 and 3, but not so much with 4. So I want to discuss that alone in detail. I am going ahead to the 4th criteria on functional analysis. Okay. Instead of this, I would rather write to do it with the case of Mr. Yes. Okay, study, sir. Person who did assist with me. If you do a functional analysis with him, forget the slide. The slide is not so very good when it comes to explaining. Let me stop sharing and let's do this. If I'm doing a functional assessment, a functional analysis of the client, I will ask the client, in what situations are you using drugs? With whom do you use? Where do you use, etc. Then, yes, what will he tell me? What will he tell me? Tell me. Where did you use drugs, sir? Heroin, where did you use, sir, every day? Every day, where do you use? Mr. Fak? Hello? Is he feeling sleepy? Is he having a headache? He's cursing his luck because he volunteered to be volunteer in the morning. He's thinking this Indian woman is going on calling me every time. Okay, let's use the examples that he provided. Where was he using drugs? Where was he using heroin? With whom? With his friends. In the evening. Isn't it? With his friends in the evening. Yes? After work. That is what we know about him. Isn't it? Yes or no? Good. That is one piece of information. Next, I will ask him, before you went to use drugs, how did you feel? Physically, how you were? He may say, oh, I was very tired after working the whole day. Then I know physically how he felt before he went to use heroin. Then I ask, emotionally, mentally, how did you feel? Oh, I am fed up. I am bored working in the morning till evening in the training room, sitting there all the time. I was just bored. I was looking for some fun time. Okay. After you took drugs, how did you feel? Oh, I did not have any body pain. I was feeling good. I was feeling very relaxed with my friends. I enjoyed chatting with him. This is an important aspect of the functional analysis. I know that drugs are a way for him to relieve body pain. It improves his mood. It gives him an enjoyable time, a relief from the monotonous work that he is doing. That is functional analysis. I am trying to understand how it changes his physical sensation, how it changes the way he thinks, how it changes his feelings, and the enjoyable aspects of his drug use. When I do that functional analysis, I know what we have to address in treatment. That means I have to find a way for him to deal with his body pain without resorting to heroin use. I have to find a way to help him relax and feel good without resorting to drug use. I teach him how to have fun without drugs or alcohol. I teach him how to get a relief from the monotony of work with other activities by spending time with his family or friends, etc., without using drugs. Can you understand what I'm saying?
Yes.
Yeah. I also asked him what are the not so good things about drug use. He says, I'm not able to be a good father. I'm not spending time with my family. I actually enjoy having a time with my cousins. Remember, in the weekends when he visits cousins, he doesn't smoke cannabis. So you are trying to understand what is very meaningful for him in his life and try to strengthen that area. You want to weaken the negatives, you want to strengthen the positives. That's what we do in functional analysis. Is that clear? Is that clear? Thank you. So with this, we close chapter module 4. Can we say goodbye to 4? Any questions so far? Any question, guys?
Professor, can you
Yes, sir.
could you kindly wrap up the functional analysis again?
Functional analysis. Just your material in the slides is not so clear. That is why I had to give some explanation. Wait, let me explain it to you again. See if you get it. Analysis means understanding. Like if I tell you, analyze your financial situation, what will you do? You'll take a look at all the savings that you have. You look at the assets that you have. You look at the loans that you have. You look at the expenses that you have to meet every month. So basically, you're looking at and the negatives. So far, so clear? Analysis means looking at positives and negatives. Yes or no, sir? Hello? I think you muted yourself. I can't hear you. Okay. So analysis means looking at positives, looking at negatives. Functional analysis means understanding the role, the function, the meaning that substance use has in a drug user's life. The role that drug use is playing in a client's life is both positive and negative. So as a counselor, I'm trying to understand what are all the positive benefits the client sees from drug use. Like when he goes to the bar to meet his girlfriend, he always has 2 bottles of beer, because without that, he's very anxious about talking to her. So the functional analysis tells me alcohol helps him reduce anxiety when he talks to the members of the opposite sex. Yes or no? Give me a thumbs up if you understand. Thai people, did you understand? Very good. So now during treatment, what I have to find, I will, if I was the counselor for this client, I would help him see how alcohol doesn't increase his communication ability. I would teach him how to start a conversation without alcohol use. Role play sessions to strengthen his skills about starting and building a conversation with people. I'll help him assess the situation. I will ask him, what does your girlfriend like about her alcohol use? What does your girlfriend dislike about her alcohol use? I will use some MI techniques. I will ask him, suppose the same amount of alcohol use continues. What is the worst thing that can happen to you in terms of your relationship with your girlfriend? He may say, oh, she may leave me and go away. So what am I doing? By understanding the role that alcohol plays in his life, I am carrying out an intervention to remove alcohol's positive effect in his lifestyle. Is that clear, sir? Like this functional analysis depends on every client. It is very client unique. Depending on the client, I try to understand. Based on the understanding, I provide an intervention. Suppose you are a physical fitness guide. You won't just prescribe a diet or a exercise regimen without meeting me, isn't it? You will want to know what is my BMI, what is my weight, what is my muscle strength, what kind of work I do, what kind of food I eat, what kind of food I like to eat. Only then you will tell me, do this exercise, do this kind of eat this kind of a food, etc. Yes or no? No. Yeah, it is very client specific. So if you want to remember functional analysis in a brief way, think about the thoughts, feelings, and behavior related to drug use. Look at the positives and the negatives. Second point. Third point, see what you can do to change it. So functional analysis means understanding his thoughts, feelings, and behavior. Look at the positives and the negatives. Thirdly, see what kind of intervention will break that relationship between drugs and that benefit. Is it clear? Can I proceed? Good. We have 1 hour more. Do you want to take a break for 5 minutes?
Yes.
Okay. You take a break for 5 minutes and then we'll continue the session. Thank you. Take a break. Thank you. Oh, God. Yes. Let me, thank you. Thank you, Natisha. Thank you. Okay. I am starting the, okay. With that, we have finished with the module 4 and we are going on to 5. If you have any questions, now would be a good time to ask. Hello. Any questions you want to raise, madam, before we go to the next module?
Let's go next module.
Next module.
Okay, next module. Okay. We are going on to curriculum module number 5. Module number 5, we are going to look at the addiction severity index. I hope all of you have a copy of it, which I asked for. Okay. So addiction severity index is one standardized tool that helps us assess many areas of a client. There are some strengths, some weaknesses in ASI. We will take a look at that. Today I will introduce ASI, the brief part. After that, I would like you to develop an outline of a case which you will be using. Okay. Let me see. I think I have to stop sharing. This is not working. This is what I plan to do in this ASI. I will introduce ASI today. I'll give you half an hour for you to develop a case outline. Make sure your case outline that you develop, give the client a name, decide what drugs he uses, how many years he is using, what kind of negative consequences he has, etc. Because we will use that case study as a basis for our role play. I would like the Thais to work in 2 groups so that you have 2 case studies. Myanmaris, do you want to work as 1 group or as 2 groups? What is your decision? Myanmaris?
Yes, it is okay for us to make it 2 groups.
Okay, fine. So today itself we will develop the outline. So tomorrow full scale we can go into role play. I will introduce every section of the ASI by explaining and role playing with somebody. Then you will go into a breakout rooms. You will use your own case. One person from your group will play the role of a client using the details of your case study. You will use the ASI to interview them, record it. You will come back. We will ask questions. Once it is clear, we will go to the next section. Like that, we will cover all the 7 sections in ASI. That is my plan. Do you like that plan or do you want to change it? You have a better idea, a better suggestion. I am willing to listen.
Professor, did you say 7 sessions?
7 in ASI, there are 7 sections, Jessica. So what they will do is, today they will develop the case study. Tomorrow I will do section by section. Like, okay, let me explain. Maybe this becomes easier for you. Maybe I'm not clear. Let me explain first. Okay, is that okay, Jessica?
Yes, please explain us more,
okay.
Professor.
That
Thank
means
you.
I'll introduce the ASI and then give the explanation for the activity. Then it makes more sense. Okay? Okay. I'll start with the ASI. Can you see the screen? No, no? Let me share the screen. Huh? Okay. Let me introduce ASI first to you. In this session, we are going to understand each question in the ASI. We will learn how to ask it, how to code it, and see how we can use this information to develop treatment plans. I want to tell you a little about the history of the ASI. This was developed by Thomas McLean in 1980. Surprisingly, it was not developed as an assessment tool. Basically, there were six treatment centers which they asked Thomas to assess. They asked him what kind of problems clients come with, and is there any change after treatment. So McLean actually developed ASI as a SUD treatment program assessment tool. He had to compare 6 organizations, 6 treatment centers. So he wanted to see what kind of clients come to each center, what kind of problems they had. After treatment, did they make a change in terms of their problems? Were they able to reduce the severity of the problem, etc. But when he started using it for that, people that it assessed the client with SUD so well that other treatment centers also started using it. After some time, other places, other states all over USA started using it. Then Europe also started using it. Then UNODC said this is a very good assessment tool. Let us teach it to other countries, other treatment centers across the world. Like that, the value of ASI became very different over a period of time. You must remember that Thomas McLean was not a doctor. He had a master's in addiction studies, like many of you here. Okay? So it gradually developed, and it was the latest edition is the 5th edition, which we will be using in our session. After that, UNODC developed something called the ASI Lite. It has about 20 or 22 questions, lesser than the 5th edition one. But for our training, we are using the 5th edition only for our training. Any questions so far? Can I have a thumbs up or thumbs down sign, please, before I proceed? Thank you. Thank you. Okay. ASI is developed only for the adult population. Do not use it with adolescents, because the questions are designed to understand the needs of an adult. An adolescent's need is very different. There have been some adaptations made from ASI for the adolescent population, but I want you to remember it was never approved of by the ASI. So ASI to be used only for adult populations. We have about 200 questions. It takes roughly about 1 hour to do ASI. But generally, when you make an appointment for doing an assessment, you generally ask the client that you tell the client it will take about 1.5 hours. Just tell that to him so that he is prepared. Otherwise, he gets very anxious, irritable, restless, which makes ASI very challenging to do. So generally, ask for a longer period of time. Make sure that people are trained to administer ASI. I remember telling you that to teach people to do a screening test, it's not very difficult. You can train them in a short period of time. But training in ASI is little more intensive. It needs some amount of training and good amount of training and understanding to do ASI well. You must remember that when McLean trained people to do ASI, he realized about 20% of people, he told them, you won't be a good ASI interviewer, so you please go away. He sent away around 20% of the people. Some of them whom he sent away were counselors, psychologists, social workers, etc. Because he said, to do the ASI in the good way, it needs the right kind of understanding and attitude. Without that, you are not a good ASI interviewer. So the skill The ability to do ASI doesn't come from your knowledge or your education. It comes from your attitude and your willingness to go ahead with the instructions that was given by the ASI developers. Any questions so far? Okay. The time there is in each of the sections when they finish, they have something called the severity rating. There are two types of severity rating: client severity rating and counselors and interviewer severity rating. Both of it I will explain later. I do not want to explain now so that we can do it step by step. There is another bullet on your slide which says norms are available. This is not necessary for our clinical work. We are clinicians. We are going to work with individual clients. So group norms are not applicable to us. In America, they used ASI as a research tool to understand how different client population, how needs of women were different from needs of men, how needs of prison-based populations were different from the people who held jobs. So for different client population, they had some norms. So you could compare them, saying in this population, his needs are severe or large. This is not at all applicable to us. So we are not going to discuss norms in this session. Is this clear? Thank you, Dr. Okay, let's move. In the ASI, we are discussing 7 major areas. All those areas are listed here, but I like to remember it differently so that it is easy for my memory. I remember it like this: medical problems, mental health problems, alcohol use, drug use. If I have alcohol and drug use, I need money. That means I need employment. So I remember it as employment and support. Who are all the people who are giving financial support? The 6th one is related to my family, friends, etc. My family and my social relationships. The last one is legal. That's how I remember. So ASI generally covers 7 areas in a person's life. It's good for you to keep all the 7 in your mind so that the interview will flow easily. Do you understand? Thank you. The reason why I am spending time to tell you the 7 areas is because ASI is very clear. All information from one section should be in that section only. It should not reflect in any other section. Let me give you an example. Suppose I was arrested by the police. That will come only in that I will talk about it only in the legal section. I was arrested due to a drug, but I won't discuss it in the drug section. Do you understand? Suppose I had an overdose. That overdose could have killed me. I almost died. That will be discussed only in the medical section because it was a threat to my life. I will discuss that as a medical issue in the section on medical status. If it had to do with withdrawal and craving, I will discuss it in the drug use section because it is only linked to my drug use. Does it make sense what I'm saying? If I have sleep problems or depression, which section will I discuss it in? Sleep problems and depression.
Mental health.
Mental health. Very good. Suppose I am talking about injecting drug use. Which section will I talk about it in?
Drug use.
About drug use. I talk about stability of job.
and support.
Stability of stability of my job, stability of my job,
Employment.
employment. You are going to ask me how much of money do you waste on you, do you spend on buying drugs or alcohol? How much of money do you spend on buying buying alcohol and or drugs?
Employment.
We have to follow the ASI very clearly. Okay, it's all listed in the ASI. The developers of ASI have a very clear idea about where questions should be listed. So follow the ASI very, very carefully. Is that okay? Okay. But remember that ASI is very comprehensive. Guys, I'm going to skip some of the slides because some of the ideas are repeatedly presented in the slide and it is very confusing for a new learner. So if I have explained that point somewhere earlier, I am not going to go repeatedly present that. Okay. I want you to take a look at this slide 5.8, one point in it. It is a semi-structured instrument. Just give me a minute. I want to, if you look at your ASI, you will see in the right hand side section, there is a big place for comments. On the left hand side of the ASI, there are structured questions. In the past 30 days, how many days did you use drugs? It is structured. But in the right hand side, there is a big gap. That big empty space is for writing comments. Every question you ask, you may get details, answers from the client, which you will make a dot, write the question number and add the details. That is why ASI is called semi-structured. Some questions are answered with yes, no, number of days, but every question you may also write details in the right hand side. Suppose there is a question which says, how many times have you been hospitalized? You will write the number of times. That is a structured question. But in the comment section, you will write details of the hospitalization. I was hospitalized in 2019 for 1 month because I had a mental breakdown. In 2016, I spent 1 day in the psych OP unit because I went into a panic. Those details will be recorded so that when you draw the treatment plan, all the details are available. Is this clear? Thank you. I want to emphasize here that the interviewer is responsible for the information that is collected. If the information is not clear, the person who's responsible is the interviewer. That is why in every ASI, there is a place which says code of the interviewer. Because we know clients with substance use problem are likely to be impatient, likely to be reluctant to give information, likely to give wrong information in different places, etc. It is your responsibility to make sure the right kind of information is recorded. Suppose you are completing the medical history, physical health history, and the client says, I was admitted with a psychiatric problem. The psychiatric problem belongs to the mental health section. So you tell the client, okay, I will be asking questions about your mental health in a later section. I will make a note of it. We can discuss it in detail later. I'll make a note of it, but I would like you to remind me about this and talk to me about this when we come to the section on mental health. In this section, I am interested in knowing all your physical issues, your medical issues, so that we will be able to understand it clearly. You are responsible for getting complete and correct information. Sometimes we may have to repeat it using simple language. You may have to use the terms that you generally use in your community. Sometimes you may have to summarize and tell the client, have I understood it right? You are telling me that you do not have any medical problems, so you do not need any special medical attention as of now during your substance use treatment. Am I understanding you clearly? And then he says, yes, I don't have medical problems, I'm fine. You have to repeat so that you understand, that you make sure that you understood the client. Every question has an intent, an understanding between the client. I am leaving this for discussion later because I do not want to confuse you. A good interviewer has a lot of positive traits. I want you now as a group to tell me, to tell me what kind of qualities a counselor should have. Tell me, if you want to be a good, counselor, what kind of qualities should I have? What would be important for me to have? Tell me. Brainstorming now, please. Tell me. Unmute, please.
There are some
Can you see
answers
me?
in the chat box, Professor.
Oh, okay. Sorry, I didn't see the chat box. Okay. Okay. Qualities of non-judgment. Okay. Good, Miss Jessica. How do I show non-judgment? I'm very careful about my non-verbal expression. The client says, I was arrested because of breaking and entering into my neighbor's house. By saying that, I've shown disapproval to the client. The client says, I was very aggressive, so they admitted me. And then you're looking at him like that. Then he knows that you are judging him. He won't be able to tell you the truth. So non-judgment is one important quality. What else? Tell me. Non-judgment is one. Confidentiality is one. What else? What are the qualities should have? Okay, let's discuss it from your slide. Okay, you are respecting the client. Very good, Ong. Very good. If you show respect, client will respect you and trust you and give information. Yes, he must see you as a trustworthy person. Professionalism. Yes, you ask questions in a clear way. You are able to explain to him. You are able to understand quickly and record the responses good. Make a good relationship with him. How do you make a good relationship? Because you are patient. You're trying to listen to him. You're trying to understand him. You try to remember details, what he told earlier on in the session, and make linkages. What else? What else? Nothing? Okay. So far so clear? Any other details we should discuss? Okay. We have about half an hour more for today. I want to use this time to create your case study. I want you to make sure our outline, you don't have to write it in detail, but it should have information about all the 4 dimensions and all the 7 areas. Just rough idea. All the 7 areas about medical, mental, alcohol, drug use, employment, etc. Remember, sometimes some clients may not have any medical issues at all. You may decide that your client is not going to have any physical health problems. You may decide the client will not have any legal troubles. That's okay by me. But you generally in your group decide who your client is, what age, what is the intensity of the substance, what is the problem, substance use, how intense the problems is, etc. Is my understanding, are my instructions clear? Unmute Thai, please. Thai people, unmute and tell me, Myanmaris, do you understand? You don't have to show me the case study. You have the case study with you, just an outline. You just discuss, brainstorm, decide, and that's it. I'm happy with that. Can you do that in the next 20 minutes?
Yes.
Yes. So you will be in your breakout rooms for 20 minutes now, please. Madam Jessica, can you break them into their groups? If we
Okay.
finish in 20 minutes, we can break for the day. Yes, Jessica.
ให้เราทำเทสที่มีทั้ง7 ข้อนั้นนะคะ
For Thai participants, you want one group or 2 groups? Opinion.
One
Okay,
One
I'm
group.
fine with that. I'm fine with that, Jessica. Then they can stay as one group. They can discuss in Thai. They can even make their notes in Thai. No problem. My whole idea is they have a framework to work on for tomorrow's sessions. I'm fine with this. Ask the Myanmaris also the same question. Myanmaris, would you like to work as one group or you want to have 2 groups? Gentlemen.
We're okay. Professor.
So Myanmaris want to work as 2 groups. I'm fine with that. So you will break now into 2 groups and develop your case outline.
Yes.
Okay.
Right.
Okay, please. Jessica, madam, you can break them into 2 groups for the Myanmaris.
Okay.
Okay.
Dr. Please join the assign. Okay.
Any questions? No?
No.
Okay. Okay. Just look through, just second guessing. I'm just going to list some details which you should have. Client's age, education, marital status, the kinds of drugs he has used, not used, alcohol, the number, whether he has had hospitalization, if he has been hospitalized for how long, does he have mental health problems, if he has, what kind, has he been treated on an outpatient or inpatient basis, then who are the people who live with him, does he give in, are other people dependent on him for their survival, for food, shelter, etc., where is he living, that kind of details. Do you have all of them? Good.
Yes.
Okay. Do you have any questions about today's sessions?
Professor, I
Do you
have
have
one
any?
question.
Please,
Yes.
please
Uh,
ask me, madam. Yes,
At the
Jessica.
end of each section, yes, at the end of each section, there is interviewer severity rating. So
Yes.
where should we see for
Okay.
for that question?
I'm going to explain that to you, Jessica, just now. Okay. In every area, I'll take 5 minutes to explain and then we can break for the day. So that it's not clear, we can revise it tomorrow. Okay. The slide, huh? We have 7 Can you see the slide, guys?
No, not yet.
Okay, then let me share it with you.
Not Sunday.
You want to, what are they saying, Jessica? They don't want to do it today. Jessica, they're saying something, the thighs, something.
I can't understand. Maybe we ask them.
Yeah. Thighs, you said something. Unmute, guys. Yes.
No, but what they were saying, like, we'll see again on Monday.
Okay. Fine. Oh, yeah. Sorry. Yeah. Okay. Just give me 5 minutes. I know it's weekend. Actually, give me 3 minutes. I'll let you go. I'll close and we'll meet on Monday. In every, we have 7 sections. We have actually one general introduction, and then we have 6 sections. In alcohol and drugs, same question about alcohol will also be asked about drugs. So basically, we have 7 areas. What we do is, in 7 areas, we'll ask all the questions. We will record, we will write comments. At the end of it, we'll ask the question, how bothered or how troubled have you been by medical issues in the past 30 days? In the section, we would have discussed whether you have any medical issues, have you been sick, did you have cold, all the details we'll ask. We want the client's impression about how much he was affected because of these health problems. Okay? When we ask him that, like let's look at medical status. Can you open your ACE? Can you have your ACE eyes? If you look at M6, you asked him, how many days have you experienced medical problems in the past 30 days? Okay? Like this, we've asked many questions. The last question is, how many days in the past 30 days you had medical problems? Remember, only medical problems. Suppose I asked Jessica that. Jessica said, in the past 1 month, I had problems on 2 days. Okay, 2 days. What happened? She said, I had a cold. Then I became better. Okay. So I'm asking, how bothered or how troubled have you been in that area? I had a cold, it didn't trouble me at all. That means I will write 0. Okay? If she says 2 days I was sick, the cold was so bad that I started gasping for breath, though 2 days were so horrible. I even thought I may die. I was so bothered about the problem. That means she will probably say considerably. That means I have a score of 3. Or she may say I was extremely bothered by it. So I will write it as 4. Is that clear? Guys, can you understand? Yeah. This is clearly the client's subjective opinion. Okay. So you will record that in the client rating scale, patient rating scale. How troubled were you in the past 30 days? You will write it there. The next question in the client severity rating is, how important it is for you to receive treatment for this. This is because we are seeing what help the client needs. Does he need medical treatment? We are asking the client, how important it is for you to receive treatment. This is very carefully needs to be understood. Whether he needs treatment. He may say, oh, those 2 days I suffered, I thought I'll almost die, but I'm fine now. I don't need any additional treatment. I'm good. That means the answer to 2 will be 0. You understand me? That or the client says, oh, it was very bad. I went to the doctor. He started me on anti-asthmatic drugs. He's given me a puff, and now I'm fine. That means no additional treatment is needed. That means it will still be 0. For question number 2, how important it is to receive treatment for this area? Because 2 means additional treatment required to what is already being provided. Is it clear?
Sorry.
Not at all. Go ahead, ma'am. Ask the question.
And then we read that for the client to answer us for the rating scale.
Whatever the client asks, as long as he understands well, you write it there. Your rating is separate. Yours will come under interviewer severity rating, which is the next one. I'll tell you how to do that later. This is clearly the client's own impression.
Okay.
It can be very subjective. Okay. See, for this breathing problem, the client might say, yes, the doctor gave me tablets, he gave me an inhaler, etc. But he told me I should learn some exercises to strengthen my breathing, to improve my lung capacity. He asked me to see a trainer for this. And I don't know where to find one. That means he is looking for additional help than what he is what he is receiving now. That additional help will be taken into consideration here. Okay, so that when you develop your treatment plan, you will see this as an unmet need, which you have to address during your treatment intervention. Am I clear? Am I clear?
Yes.
Okay, good for this. If you've got this for today, and this will be done for each section separately. Medical needs will be assessed separately. Let's suppose he has let's suppose what he has. He has he has an abscess. Abscess is a medical problem, no? Medical problem means come under this section. Craving, withdrawal, etc. will come under the drug use section. Do you get me? Good. The interviewer severity rating is slightly more difficult. This is how it looks like. You can find the ASI interview severity rating on your slide at 5.149. It is presented far away. I want you to understand it at the same time so that it becomes easy. Can I explain now, or you want me to do it on Monday? Do you want me to explain interviewer severity rating now, or you want to do it on Monday?
Day, Professor.
Pardon, Dr. Arkat?
Monday.
Monday, okay, because it's slightly complicated. I also prefer that you are fresh for that. Okay, so thank you all. Thank you for your time. Thank you for your patience and your focus. Have a good weekend, and let's meet on Monday morning at your time. Goodbye. Have a great